So welcome to Chapter 12 in Pharmacology. This is drugs for psychoses. Most psychoses have no identifiable cause and require long-term drug therapy. Some of the possible causes for psychoses are trauma, overdoses of certain medications, for example, cannabis, amphetamines, cocaine, or alcohol. And another cause of psychoses can be brain damage. So again, psychoses can be caused by trauma, overdoses of certain medications, and brain damage. The signs and symptoms of psychoses, which are important to know, include delusions, which is strong beliefs in something that's false or not based on reality. For example, the patient might believe someone is planning thoughts in their head. Hallucinations is another signs and symptoms. Seeing, hearing, or feeling something that's not there. The example used is the patient may hear voices or see spiders crawling on the walls that others don't hear or see. And then illusions. That's distorted or misleading perceptions of something that is actually real. An example is that the patient might see a shadow and believe it's really a person. Another sign and symptom of psychosis is disorganized behavior. The example they use here is if a patient might wear clothes that's entirely inappropriate manner and for no apparent reason, such as dressing up with layers of clothes, including a hat, sunglasses, and several pairs of socks over the hands and feet. Another sign and symptom, difficulty relating to others. For example, the patient might become withdrawn from other people in the room, show signs of distress, maybe even turning combative if confronted or questioned. Behavior can range from total inactivity to extreme agitation. Paranoia, the suspicion or mistrust without justification or evidence. An example might be that the patient might have an extreme suspicion that they're being followed or that someone is trying to kill them. So those are all signs and symptoms, and those would be an important thing to know for the quiz. So the first psychosis we'll talk about is schizophrenia. And patients with schizophrenia experience a lot of different symptoms that can change over time. It is a type of psychosis. It's characterized by abnormal thoughts and thought processes, disordered communication, withdrawal from other people and from the outside environment, and a high risk for suicide. There are a lot of different subtypes of schizophrenic disorders based on how the person presents clinically. There are positive symptoms of schizophrenia, and those are symptoms that add a behavior, thought, or feeling. So you're adding or positive symptoms, and those might be hallucinations, delusions, or paranoia. Strange behavior, like talking in rambling statements, making up words, strange or irrational actions, and changes from stupor to extreme hyperactivity. So from one end of the spectrum to the other. Positive symptoms are treated best with drugs called thorazine and phenazine. And those are listed later in the PowerPoint. But thorazine and phenazine, they are antipsychotics or phenothiazines. The antipsychotics that are used to treat the positive symptoms take 7 to 8 weeks to become effective. And caffeine negates the effect of those antipsychotics. Negative symptoms, on the other hand, take away a behavior, thought, or feeling. So it's an attitude of indifference towards or detachment from life activities. neglecting personal hygiene, job, and school, noticeable withdrawal from social activities and relationships, and changes from hyperactivity to stupor. So, those are negative symptoms of schizophrenia, where um, they take away a behavior, thought, or feeling. And I said the positive symptoms are best treated with thorazine and phenazine, which are antipsychotics. If the patient is experiencing both positive and negative symptoms, it's best treated with something called Clozaril, Clozaril, and that's listed in a table later in the PowerPoint, but it's an atypical antipsychotic. And then the cognitive symptoms of schizophrenia include the poor ability to make decisions and to understand information, problems applying information once learning has occurred, and also trouble paying attention. So, the causes of schizophrenia, there are several different theories proposed, but there's one theory proposing that there's a genetic component of schizophrenia. And then also another proposed theory is that there are imbalances of neurotransmitters in specific brain regions. And schizophrenia is treated with antipsychotics. When you're taking antipsychotics, you want to avoid alcohol because it can increase the depressive effects of antipsychotics. And in order to successfully manage psychoses pharmacologically, really the experience and skills of a healthcare provider are critical. It can be really challenging when you're trying to help medically manage a person with something such as schizophrenia or another kind of psychoses. The patients don't see their behavior as abnormal, and that causes them to have difficulty understanding the need for medication, and their compliance diminishes if the medication has undesirable adverse effects. So that's another challenge for healthcare providers who are helping with the medical management of severe mental illness. So the primary goal of pharmacotherapy for patients with schizophrenia is to reduce psychotic symptoms to a level that allows the patient to maintain satisfactory social relationships as well as self-care and keeping a job. So that's the goal of pharmacotherapy for patients with schizophrenia. Again, reduce psychotic symptoms to a level that allows the patient to maintain satisfactory social relationships as well as self-care and keeping a job. Conventional antipsychotic drugs includes the phenothiazines, phenothiazine-like drugs, and non-phenothiazines. And this table is just listing some of the conventional antipsychotics, the phenothiazines. And you'll see the top two there are chlorpromazine and fluvenazine. Compazine is another one that you may have heard of. This is a list of the potential adverse effects of conventional antipsychotics, and look at all the things that they can have. So sometimes the antipsychotics are kind of a risky drug to take. And then these are the non-phenothiazines. Haldol is one you may have heard of. If an elderly person is taking or being prescribed these medications, they want to start out at half the normal dose because they won't need as much of the medication. There's something called extrapyramidal adverse effects, and those are covered on the next 4 slides. But they're adverse reactions to antipsychotic drugs. They happen early in the course of pharmacotherapy, and they include acute dystonias, which is involuntary. It involves severe muscle spasms, particularly of the back, neck, tongue, and face. So it's an involuntary movement, and maybe some of you have seen those if you've been on any kind of in any mental institution or a floor that specializes in mental illness. They often give a drug called cogentin, which is actually an anticholinergic for the muscle spasms. Cogentin is spelled Cogentin. They'll give that for muscle spasms. And then extrapyramidal adverse effects also include akathisia. That's the most common extrapyramidal adverse effect. It's the inability to rest or relax. Also, secondary Parkinsonism, where it mimics Parkinson's, where they tremor, have muscle rigidity, a stooped posture, bradykinesia, and shuffling gait. And then something called tardive dyskinesia, which is unusual tongue and facial movements. So if these effects are reported early and the drug is stopped or reduced, the adverse effects can be reversible. However, with higher doses given for long periods of time, these extrapyramidal adverse effects can become permanent, which is really a big issue. So with conventional antipsychotics, it's not always possible to control symptoms without producing some degree of these extrapyramidal adverse effects. And the concurrent pharmacotherapy with an anticholinergic drug may prevent some of the EPS. And I had mentioned a couple slides earlier that the cogentin is one of those anticholinergic drugs. Atypical antipsychotic drugs address the needs of patients with psychoses. Atypical antipsychotic drugs have a broader spectrum of action than the conventional ones. They can control both positive and negative symptoms of schizophrenia. At therapeutic doses, they can exhibit those antipsychotic actions without producing major EPS effects of conventional drugs. And they can cause neutropenia and agranulocytosis. Neutropenia is decreased neutrophils, which can lead to infection. And the agranulocytosis is lack of white blood cells. So this is a listing of the atypical antipsychotic drugs over the next 2 slides. Seroquel and risperidol are some of the more common ones. And then there's something called third-generation antipsychotics. A dopamine serotonin system stabilizer or dopamine partial agonists. And those include things like Abilify and Rexulti, and they have less EPS than Haldol. There's the low incidence of adverse effects, and the patient will still be able to have less psychotic behavior. And there are the two drugs that we just mentioned, the Abilify and Rexulti. Okay, so this concludes chapter 12. Make sure that you're reading your book and doing the end of chapter questions and the associated workbook questions. This PowerPoint is just an overview of the chapter. It's really important that you read your chapters on your own.